master's degree in counseling from Missouri State University and a doctorate in counselor education from the University of Arkansas. I'm a licensed professional counselor by the state of Missouri. This is my 40th year as a counselor. I use primarily two personality tests when I deal with issues like Renee as screening devices. Anyone who goes through a psychiatric evaluation for any kind of psychotic conditions usually will be given the MMPI-2, the personality test, and had her to go to a private place and take them and then bring them back to me. I saw her for 12, about 10 to 12 clinical hours, debriefing her on the results of the test and hearing her tell in her own words what the situation she had run into through the divorce proceedings with her husband.
Obviously, there was another report that was written about her. Had you seen that report before you did this interview?
No, I did not. I did not. There were, Ms. Holyfield brought two reports to me. One of them was from a Dr. Joe Hillman from Starkville, Mississippi, who is a psychiatrist. This was, his evaluation was done on October the 7th in 2010, and his evaluation was congruent with mine. He did not find any kind of abnormalities in Miss Holyfield's personality. I have a copy of the mental status exam. He did not go into in-depth testing because in talking with her, he did not see any indicators of any abnormalities at all. And the other one was the one that was given to me by Ms. Holyfield from Dr. Kathleen Ronan, who is a clinical and forensic psychologist. Her report reflected that Ms. Holyfield had some disturbing psychiatric disorders. She used words such as psychotic, mood disorders, but in her report, there are several ways in which you can reflect a diagnosis. And a couple of the phrases in the DSM-4, which is the Bible, so to speak, that psychologists use, they have, say, like psychotic disorder not otherwise specified. That means it's like trying to nail jello to the wall with a nail and a hammer. You may suspect some tendencies there, but you can't prove it. And so when I looked at Dr. Ronan's report, I wondered myself professionally why she did not administer the MMPI-2, which would readily identify some of the disorders that she identified in her report, such as psychotic disorders, somatoform or concern about bodily functions, paranoid delusional, and schizophrenia. In the assignment of a guardian ad litem, that means a person is incapable of making decisions on her own, and that person, the guardian ad litem, must be consulted on decision-making process. One of the things that, as a counselor, that I look at, if guardian ad litem, is if she had both the test of Dr. Coleman and Dr. Ronan, is if she's going to be a guardian ad litem, I would think that she would try to get to the bottom of this, because if I'm going to take my professional responsibility seriously, I've got two conflicting reports here. One says this person can't function, and another one says this person can function very well at a high level. They say that down the hill there's something rotten in Denmark. It don't add up. I think Miss Holyfield's problem with this divorce proceeding, as she shared with me, is she was looking for justice, and that is not what she found whenever she went and got her divorce. Being declared mentally incompetent without going before the judge herself, I find that, well, if you study psychology, you find case histories where family members get together and there is what we call the identified patient in the family. They just don't want them to be part of the family, and so they get together and find a lawyer, and then they declare them to be mentally incompetent and put away somewhere. And so that appears from looking at what the data that I saw from Dr. Hillman and what I observed, that there was someone who didn't want to hear what Miss Holyfield had to say. And the guardian ad litem normally is used for children, and these people are tenacious in protecting the rights of their clients.
From your evaluation, would you at all find that she was anywhere near incompetent to stand trial or incompetent to even take care of herself at all?
No, I was so confident in her ability to manage her own affairs that I instructed her to get that removed just as rapidly as possible, and then to seek counsel to rectify whatever misjustice that may have been caused by this decision. Unless this is expunged from the record, and that will be somewhere in these legal proceedings, I will recommend to Ms. Holyfield that she petition the court to have that part of her record expunged from the divorce hearings. Now, let me address one other issue that's in the report, and that is that Ms. Holyfield was given an intelligence test. The intelligence test, under the circumstances, under the duress that she was under when she took that intelligence test, I think would impede, or I know would impede, the answers that she would give. Miss Holyfield has been is a very accomplished musician, very, very accomplished. And when you are in your middle 40s and you have devoted your life to a particular science or a particular discipline that's not inside the area of academia, one's ability to recall data, especially under the amount of stress that she was under during these divorce proceedings, I would really question the validity of that IQ test. It was not given under the most favorable circumstances. And so whenever I looked at the IQ score, and after I interviewed her and talked with her, I would really question the validity of the IQ score that was administered during those sessions. One of the things that I've had the joy of doing is, in addition to being a counselor, I've also been a college professor for over 35 years. And one of the courses that I taught in psychology was abnormal psychology. I taught that sometimes 3 semesters or 2 semesters and summer school. And so having taught that course for a number of years, I think I would readily recognize those characteristics that Dr. Ronan described in her report. And I did not see any of that in Ms. Holyfield's interview.